Imagine a community where older adults thrive, where neighbors look out for each other, support is close at hand, and everyone feels empowered to age in place. For many Canadians, home has been an apartment, co-op, condo, or public housing. In these buildings, you'll often find people of all ages, children, parents, grandparents, living side by side. In recent years, though, an interesting trend has emerged in cities like Toronto. Some buildings now have a larger proportion of older adults who, for a variety of reasons, are choosing to stay. As a result, some of these once multi-generational buildings are seeing more and more older adults. Without any planning, they've transformed into something special, naturally occurring retirement communities, or NORCs. In Toronto, nearly 500 high-rise buildings are now home to older adults, reflecting a shift in how and where seniors are aging. But what does a truly livable community for older adults look like? Let's learn more about naturally occurring retirement communities known as NORCs and take a closer look at the broader picture in these vertical communities. With more older adults choosing to live in apartments and condos than ever before, there's a huge opportunity to rethink models of care. The NORC Innovation Centre at UHN, Canada's largest research hospital, is on a bold mission to design the future of aging in place by turning these buildings into vibrant ecosystems of health, connection, and choice. The NORC Innovation Centre is leading the way in advancing new models of social connection and accessible care. NORCs are showing us how aging in place can be vibrant, dignified, and full of possibility for individuals and for society as a whole. The NORC model merges integrated care delivery with a community development approach. Virtual care navigators, wellness programs, and social activities are woven into daily life, all tailored to the people who live here. It's care plus community, working together. NORCs are more than just places, they're powerful networks of social connection. Neighbors become friends, volunteers, and even lifelines. These bonds reduce loneliness, boost mental health, and create a sense of purpose for everyone involved. Older adults aren't just residents, they're leaders. The center empowers them to co-design solutions, building on their strengths and wisdom. And it's all partnership-based. Housing providers, health teams, and policymakers collaborate to make services sustainable and scalable. Successful NORC, naturally occurring retirement community, buildings rely on a combination of resident involvement, community partnerships, and supportive services. Key players include the residents themselves, who often take the lead in developing and managing programs, as well as local care providers and community organizations that provide health and social services. If we want older adults to truly thrive where they live, we need more than good intentions. We need long-term sustainable funding. Funding that brings together housing, healthcare, and community support. Because aging in place should be supported, not left to chance. When we invest in people, programs, and partnerships, we build more than support systems. We build resilient communities that last. When we invest in people, programs, and partnerships, we build more than support systems. We build resilient communities that last. Let's work together, across sectors and generations, to make sure older adults have what they need to live with dignity, connection, and strength. Looking to build your own aging-in-place community? Whether you've already started or are keen to get going, find new ideas and tips to build community and enjoy getting older together. The NORC Toolkit contains practical ideas to help older adults stay healthy, stay engaged, and stay connected.